Hello everyone. Very good evening to all of you. Am I clearly visible, audible? First, I will wait for your comment in the comment box. Kindly assure me that I'm clearly visible, audible, everything is good to go, so I will start the session ahead. Okay, I'm waiting for your comments. Am I clearly visible, audible? I'll start the session soon. First, you write down in the comment box who's those all who are live. Is everything is good to go? You can see, you can hear. Can we start? Yes, I guess yes. I guess yes. Hi Harika. Hi Swatima. Thank you. Thank you. Thank you, Reddy. Thank you. Okay, I got it. Thank you so much for confirmation. So I welcome you all for today's session. Very good evening to all of you. And today we are going to continue our topic of forensic medicine, which we have started yesterday. So as you all know, these are the demo sessions of third Prof Buster 1.0. So I will continue my topic, that is postmortem changes, which I have left incomplete yesterday. So yesterday was the first session of forensic medicine on YouTube and I started this topic. I guess most of you may have attended it. Yes or no? So if you have not attended it, you can watch it on the YouTube as well as it is uploaded on the app also. Okay. And today we are going to complete it, finish it. It's a big topic, very important topic. But before coming on this topic, as many students I can see they are new here. So I will just for few seconds, I will orient regarding the groundbreaking course, that is third Prof Buster 1.0. Okay, so what is the most important thing here in this course which I want to highlight over here? I am going to complete these 4 subjects in just 4 months, 10 days. Yes, I'm going to complete all these 4 subjects of the third Prof. Most of the students have only PSM and FMT in third Prof and ENT Ophthal in the final year. But my advice for all of you, you should cover ENT and Ophthal also in the third year. Okay, so if you are covering these 4 subjects in just 4 months, that is, they will be completed in February itself. So from February onwards, you have ample of time to start these major subjects of your final year. I will not be teaching you these subjects, but I'm providing you, I'm giving you the time to study from wherever you want to these subjects. Because I will assure you, these 4 subjects will be completed from both prospects. I mean, for NEET, PG, FMG, MCQs also, and for your university exam also. You don't have to touch any of these 4 subjects. You have to just revise before your exam after February. So that is the biggest thing of this course. Okay, that is third Prof Buster 1.0. All these 4 subjects will be covered by me in the daily live sessions we will take. I guess the sessions are not daily. The pre-provided structured schedule is with you. We have 2:1 ratio. 2 days class, 1 day break. 2 days class, 1 day break. With such a schedule, we are completing the entire syllabus of these 4 subjects in 4 months, 10 days. Right? So this is the starting date. It is already started. And I guess today is the 4th session. And 22 February will be the last date of this session. You can see the detailed schedule over here. And along with the daily live sessions, recordings will be available for 1 year. The sessions will be, live sessions will be for 4 months, but the recordings of those will be available for 1 year. One more big thing here I want to announce, along with the digital note, I am providing printable notes. Whatever I am teaching in the class, word to word, slide to slide, you can get the printable notes, but you have to take the printout by yourself. Okay, the hard copy books are not shipped in this combo plan. Okay, hard copy books are under publication. It will take months, it will take time, but meanwhile I'm providing you my notes. You can take the printout, whatever I'm teaching word to word, you will get there. Okay, so digital notes, printable notes, annotated notes, all the notes will be provided to you. You will be given 3 type of question bank for university exam as well as competitive exam as well as previous year question bank. Okay, now PSM and FMT I will teach you with multiple images. You will realize today in FMT how many images I'm going to show you so that it imbibe in your mind. And ENT Ophthal I will teach you with 3D models. Don't you dare to miss my demo sessions of ENT and Ophthal. My next 2 sessions are demo sessions, so I'm going to teach you ENT and Ophthal with these 3D models so that you will have a better understanding, better clarity in 3 dimension. I will change my camera to show you all these 3D models layer by layer, structure by structure. So please do attend my demo sessions at least. So total there are 87 live sessions. Out of the 87, today is the 4th one. In these 87 live sessions, I will pack the entire syllabus of the 4 subjects. So today is demo number 4. So PSM demos are already completed. FMT will be completed today. After that, we have ENT and Ophthal demo. You can appreciate the topics of that. Okay, so let's start it. If you have any other query, you can WhatsApp on this number. Now let's start. Let's come on our topic, that is postmortem changes. Yes, can we start? Are you people there? Yes. Okay. Yes. So chalo, let's start it. So let's continue postmortem changes. But you know my way of teaching. I cannot continue directly. So in the first 5 minutes, we will revise what we have read yesterday. In my classes, there will be multiple revision so that you retain everything in the class itself. You don't have to open the book later on. Got it? So in the first few minutes, 2-3 minutes, we will revise yesterday's session and then we will continue because I cannot jump directly on the topic where I have left. Okay, so postmortem changes. The first question which arises in my mind, being a doctor, why? Why it is necessary to understand the postmortem changes? Why is it necessary, being a doctor, for me to understand the postmortem changes? Why it is there in MBBS curriculum? Yes, it is necessary because the answer is as soon as the death occurs, the dead body starts writing its own report. There are many clues hidden in the dead body which occurs every second, every minute. Okay, what is our job, being a doctor? Our job to detect those clues, being detective, detect those clues and tell two things. Number one, when the life stop and how the life stop. Only two questions in medical legal cases. Most of the medical legal cases, the forensic expert, what is the job of the forensic expert? To tell two things to the police. What two things? When life ended and how does it happen. Okay, so we can come on that, we can help the police and the judiciary to come on this conclusion based on the clues in the postmortem. So that's why postmortem changes are very important to understand. Now we divide the postmortem changes into three categories. Yesterday also I taught you immediate changes which show somatic death, early changes which show cellular death, and late changes which show decomposition and decay of the body. Okay, so immediate changes are 3 in number, early changes are 6 in number, and late changes are again 3 in number, so total 12 changes, out of which the immediate are done yesterday. The early are also done yesterday. So out of 12, the 9 are done yesterday. Today we are left only with the late changes. They are looking very small, but all three are long questions for your university exam. They are big topics. So we will focus on them one by one. All three we are going to see in detail. Before that, a quick snapshot of these and these. Okay, so immediate are 3 in number. I told you a mnemonic to learn the 3. Okay, what are the 3 immediate changes? Insensibility and voluntary loss of the muscles, cessation of respiration, cessation of circulation. You can see this is insensibility, the earliest postmortem change. It's an MCQ, but not reliable. It is seen in suspended animations also. Okay, number 2, cessation of respiration for more than 5 minutes is evident of death. Again, cessation of circulation for more than 5 minutes, okay, is evident of death. So cessation of respiration and circulation for more than 5 minutes is evident of death, but they should be complete and continuous. So it differentiated from suspended animation. What is suspended animation? Yesterday I taught you. So we have seen a quick review of these three. Now a quick review of these and then we will come on today's topic. So early changes. Yesterday I taught you the 6 early changes. Changes in skin, changes in eye, changes in muscle, cooling of body, that is rigor mortis, postmortem lividity and rigor mortis. Yes or no? Yesterday I taught you, na? So again, I taught you a mnemonic here also to learn. The mnemonic here was the IRC, I really collapse, I really collapse. Insensibility, respiration cessation, circulation cessation. Okay, here the mnemonic is in front of you. The mnemonic is see me clear, CMCLR clear. Okay, so you can see S stand for changes in skin, E stand for changes in eye, M for changes in muscle, C for cooling, L for lividity, and R for rigor mortis. So quickly, we will revise only important one slide on that, and then we will move on the late changes. That is the main topic for today. Okay, so changes in the skin, we have seen 2 changes in the skin. Number 1, skin loses its elasticity, become dark color, ash color, and in the lips also become red and dry. So that is changes in the skin. Changes in the skin. You learn these images. If you have watched my yesterday session, you can remember. Changes in the eye. I taught you 6 changes in the eye. You remember the 6 changes in the eye? Loss of corneal reflex. Okay. Cornea become opaque. Opacity in the cornea. And there are triangles formed in the cornea. I'm sorry. The base of the triangle is like this. And the apex is like this. You can see. The base is towards corneal margin. And the apex is towards the canthus. Medial and lateral canthus. These triangles are known as techinoid. Due to the loss of intraocular pressure, eyes are sunken. The third change. First, second, third. Pupil, sometime initially it is dilated, but later on when the rigor mortis come, it's constricted. So initially dilated, then constricted. Okay, what about the retinal blood vessels? The retinal blood vessels shows fragmentation of blood. as soon as the death occurs. Fragmentation of blood. This is known as what it is known as? Yes, Kevorkian sign. Don't you forget. Kevorkian sign. It's an MCQ. And the vitreous humor. We aspirate the vitreous humor from the dead body and see the potassium level. Potassium level rise up to 100 hours steadily. So it helps us to estimate the death, time of death. So these are the 6 changes in the eye. I told you all of them yesterday in detail. Muscular changes. Okay. So as soon as the death occurs, the complete body relax. Unless until it again contract when rigor mortis come. Okay. So complete relaxation, but with electric stimulation, it responds. But in this phase, there are twitchings. Appreciate the twitchings. Twitchings are there. Pupil don't respond to light, but it responds to atropine and physostigmin. Okay. And there is the peristalsis still going on. And there is relaxation of the sphincter. Okay. Urinary sphincter, bladder sphincter, anal canal sphincter. So there is evacuation of the bowel. Incontinence of the urine and feces occurs in dead body, which is very common immediately after. Okay, so these are the changes in the muscle. Then I told you cooling of body. Remembering rigor mortis. So body lose heat after death by all 3 mechanisms: conduction, convection, radiation, as well as evaporation. I told you how to draw this graph yesterday. And there is a temperature gradient between the core and the surface. Okay, and I told you a formula how to calculate the time from cooling of body, time of death. Okay, this was the formula yesterday I taught you. How to measure the temperature of dead body? Rectal temperature, liver, peritoneal surface temperature, and internal auditory canal temperature. These are the 3 ways to measure the temperature in a dead body. Yesterday I taught you. Then postmortem lividity. What is postmortem lividity? Remembering staining of the dead body. The dead body started staining few hours after the death, maybe 1 to 2 hours. Okay, why it happens? Because as soon as the death occurs, circulation stop and the blood sink due to the gravity. RBC, WBC, everything sink, and the hemoglobin of the RBC is giving this color. The reduced hemoglobin is giving this color. That is known as lividity. Okay, postmortem lividity, or known as hypostasis. I told you all the features regarding this, and it depends. The position of this depends on the position of the dead body. I told you what happens in supine, in prone, in lateral position. Okay, in inversion of head position, hanging position, droning. I told you the lividity, the features of the lividity, where it will occur. Okay, the distribution you can say. And last I taught you rigor mortis, the rigidity of the dead body. So initially, as soon as the death occurs, the complete body relaxes. But after a few hours, it contracts. Okay, you can appreciate the contraction. You can appreciate the contraction. That is rigor mortis. Okay, I told you the sequence of the muscles showing contraction. First involuntary, then voluntary. Right? So we are done. This was the revision, people. I know it was boring maybe for few of you, but it's essential part. You know, revision is essential as compared to studying new things. Now you have revised, now it is fixed in your mind forever. Okay, anything which is revised at least once, it is fixed in your mind. Okay, now we will start with today's topic, that is late changes, late postmortem changes. Immediate are done, early are done. We have revised them, and now we will start the late changes. There are 3 late changes. Are you people there? Yes? Chale? Can we continue? The 3 late changes. What are the 3 late postmortem changes? The mnemonic is PAM, whatever you say, PAM after life, PAM after life. P for putrefaction, A for adipocere formation, and M for mummification. So these are the 3 late changes. We have done immediate, we have done early, and now late changes. So this immediate indicates somatic death, early indicates cellular death, but the late changes, what I am teaching you today, today's topic, what I am teaching you, the late changes indicate decomposition of the dead body, decomposition and decay of the dead body. What are the 3 late changes? Putrefaction, adipocere formation, and mummification. The mnemonic is PAM, P-A-M, PAM. The mnemonic is PAM. Got it? Just a second. I'm sorry. So we will start them one by one. So can I start with the first one? All 3 are very big people. The biggest among them is putrefaction, on which you get frequently long question if you are appearing for your 3rd Prof university exams. So it is a frequent long question. Okay, very important, and you get many MCQs also. And these are also important. Mummification is equally important. Okay, so let's start with the first one, putrefaction. I'm starting with the first one, putrefaction. Can I start putrefaction? Before I start the first one, putrefaction, let me give you an overview of all 3. So I'm teaching you the late changes PAM, P-A-M, PAM, putrefaction, adipocere formation, and mummification. So first you understand The basically what they are. Read their definition. You can see the 3 definition, or else you can see their images. You will realize what they are. So this is PAM, putrefaction, adipocere formation, and mummification. So one by one we will see. What is putrefaction? Now bacteria, dead body attracts bacteria. You know, bacteria will attack on the dead body. These are not external bacteria. These are commensal bacteria. The bacteria which are usually present in living body. What is commensal? Commensal bacteria are the good bacteria. They are already present in human body. They don't harm us. They are not pathogenic, but they change your location. I mean, the bacteria which are present in my oral cavity, they are commensal for the oral cavity. But once they enter in the soft tissue in other organs, they are no more commensal. They become pathogenic. I mean, they are harmful like that. So the commensal bacteria, they attack the soft tissue, destroy the soft tissue, and that is known as putrefaction. So that is known as putrefaction. The dead body become like this. Okay. And there is a peculiar odor, smell, which comes from the dead body. The dead body get liquefied, okay, because of the bacteria, and that is known as putrefaction. I will give you the details. So putrefaction, learn the main word in the definition of the putrefaction. It's bacterial destruction of the dead body. Bacterial destruction of the soft tissue of the first soft tissue of the dead body is destroyed, and later on the skeleton of the dead body is also destroyed. But for destroying skeleton, it requires years, and soft tissue destruction occurs in days and months. Okay, so bacterial destruction of the dead body is putrefaction. What is putrefaction? Learn one word in the definition. It is bacterial destruction of the dead body. That is putrefaction. The second I will teach you, I will give you the detail. First you learn the definition of the 3. Then I will give you the detail of all 3 one by one. Okay. The second is adipocere formation. What is adipocere? We all have fat in our body, no? We have 0.5% of fat, subcutaneous fat in our body. Our entire body contains the fat, whether the person is lean, thin, obese, whatever. But we all have some amount of fat in our body. Okay, that fat in human body, body fat, after death, that fat get converted into a waxy, greasy, water-resistant material. And that material, it is a soap like, you can say it is saponification. Have you read saponification in chemistry in your childhood? I mean in your school time, saponification. So adipocere is basically saponification. So fat of the human body is converted into soap. Okay, conversion of fat into soap like substance, which is waxy, which is greasy, which is water resistant. And this soap is known as adipocere. So this is known as adipocere formation. Can you see yellowishness of the body? Appreciate. Here the color initially green, later on purple, finally black. And here it is yellowish. Okay, so it's a modification of putrefaction. It prevents putrefaction. They don't occur simultaneously. If adipocere is occurring, it prevents putrefaction. Okay, in putrefaction, the body gets destroyed. It's very difficult to identify the body after putrefaction because the facial expressions, facial identity, everything gets destroyed. But in adipocere, it is maintained to some extent. Okay, so this is adipocere. So when adipocere formation occurs, when moisture is there, when the dead body is in moisture, in moist environment, then it favors this. When the dead body is in air, then it favors this. When it is in moisture, it favors this. I will teach you the details. First you understand. So here the fat of the body, one word you learn. Here the fat of the body get converted into adipocere. Adipocere. What is adipocere? It's a soap-like substance. It's water resistant and it's waxy, greasy substance. So this is known as adipocere formation and it prevents putrefaction. That is the thing. Okay. Now third and the last is mummification. You can see mummification. Mummification occurs because of drying. The entire dead body is in hot environment. It gets dried. We all have water, of course. Human body contains how many percent of water? After death, if the dead body is kept in hot atmosphere, very hot atmosphere, all the water in the dead body get evaporated. Okay, so drying, complete drying or dehydration of the dead body because of evaporation of water. It is known as mummification. Again, it prevents putrefaction. So these two are the modifications of putrefaction. They prevent putrefaction. Okay, again here facial expressions are retained even after years and thousand years. We got the mummies, na? Deep burial mummies in the history, you may have read it. So this is mummification. Mummification is due to drying or dehydration. So you understood the definition. So one word you learn here is drying or dehydration of the dead body because of evaporation of water. You got the 3 definition. Bacterial destruction of the dead body. First soft tissue, then skeleton. It is known as putrefaction. It destroys the complete body. It's difficult to identify the body after putrefaction. What is adipocere formation? The fat in the dead body get converted into a waxy, greasy, water-resistant, soap-like material which is known as adipocere. It prevents putrefaction. And what is mummification? Mummification is dehydration and drying of the dead body. Okay? Dehydration and drying of the dead body because of evaporation of water. That is known as mummification. Appreciate the 3 definitions. and appreciate the three images. Can I start them one by one? Can I start with the first one, putrefaction? How many of you are ready? Can we start? Chalo. So we will start. So just a second. We will start with putrefaction. I'm starting with the first one. You got the overview, what I'm going to teach you in the next 1.5 to 2 hours. Okay. These three things I'm going to teach you in detail. So most of you know my way of teaching. I don't teach the topic haphazardly, line by line, paragraph by paragraph. I always give you orientation before I start. So before I start, I told you I have given you a bird's eye view, that the entire map, what I'm going to teach in the next 2 hours. These three topics. What's the difference between the three? You got their three definition. Now details of each of them. Okay. So putrefaction is a long question. If it is coming as a long question, you have to frame your answer under these headings. You have to revise these headings before you go to your exam. You don't have to mug up inside the heading. Inside the heading, you understand and write your own. But headings, you cannot skip the headings. So putrefaction, write down the definition, introduction, whatever you say. Then tell me the mechanism of putrefaction. There are three main features in putrefaction, the three cornerstones of the putrefaction. Color change in putrefaction, gas evolution or gas formation, the dead body form the gases, and distend, the dead body get distended. Sometimes rupture occurs, abdominal rupture, eye rupture because of the gas formation. I will show you the images. And finally, the dead body get liquefied. First color change occur, then gas formation occur, and finally the dead body get liquefied. Sometimes if the dead body is in some forest or very far away from the reach of the human, and after many days or months the dead body is found, it is most of it is liquefied. Sometimes it happens in case of murders or some eventful death like that. So liquefaction of the dead body. So these are the three main features which I will give you the detail. Then after these features, then I will give you the distribution of putrefaction. Then factors affecting putrefaction, rate of putrefaction. Then from the putrefied body, there is a peculiar smell which comes, which is known as odor mortis. You should know this term. What is odor mortis? What happens if the dead body is in water in case of drowning or homicide, suicide, whatever? So putrefaction in water. And what about the skeletonization? Here the soft tissue is destroyed. Finally, putrefaction destroys the skeleton also. So first you understand the headings, people, under which you have to frame your answer. One by one we will discuss. Let's start with the introduction. Okay, you have seen the headings. Now I will show you this page in the end after half an hour or 40 minutes when we will complete all these headings. So we will revise it. So focus on each and every heading. Okay, so start with the definition. What's the definition of putrefaction? I already told you. It is final stage of the postmortem changes. I'm teaching you late changes now. Immediate changes are done, early changes are done. What I'm teaching you? Late changes. So it is one of the late change, final stage of postmortem. You already know that. What's the definition? It is bacterial destruction of the soft tissue of the dead body. And later on, the skeleton of the dead body. Basically, bacterial destruction of the dead body. Bacterial destruction. The dead body is destroyed by the bacteria. Okay. It follows after disappearance of the rigor mortis. You remember I told you three type of changes. Now, what were the three type of changes I told you? Postmortem changes. Immediate changes were three. You know the three immediate changes. Early changes are six. What was the sixth change? Sixth early change. Sixth early change is rigor mortis. So once the rigor mortis disappear, then putrefaction appear. So putrefaction occur after the disappearance of rigor mortis. I think you can correlate. Okay. So this line is written here. So it follows putrefaction occur after disappearance of rigor mortis. Okay. So that is the definition. I hope everyone got the introduction, definition. Now mechanism. Most important is mechanism. How does it occur? How does it occur? So after death, obviously respiration stop. Immediate sign. What is the immediate postmortem sign? Three signs. Insensibility, cessation of respiration, and cessation of circulation. So cessation of respiration. As soon as the death occur, respiration stop. So since the respiration stop, person is not inhaling, exhaling. So oxygen concentration in the dead body is less. Oxygen concentration in the blood falls because person is not respiring. Person is dead. Okay. And hydrogen ions concentration is high. So oxygen concentration is less and hydrogen ion concentration is high as soon as the death occurs. And this is the ideal condition for bacterial growth. Bacteria grow in low oxygen and high hydrogen ions. It's the ideal condition for the bacterial growth. Now post-death, the bacteria, which bacteria? The commensal bacteria, which are already present in the intestine, respiratory tract or wound. If before death some wound is there, in the wound may be contaminated with the bacteria. Okay, so these are the commensal bacteria. This is the commensal bacteria in the intestine. This is the commensal bacteria in the respiratory tract. Or in the wound, they can be pathogenic bacteria. So the bacteria which are already present in the dead body, they multiply within 4 hours. You can see. So these are the bacteria already present in the intestine. The bacteria already present in the respiratory tract, or the bacteria already present in the wound. They will multiply because oxygen is less and hydrogen ions are more. You can see. Mainly it is intestinal bacteria. They multiply. You can see they multiply like this. They keep on multiplying at a very high rate via binary fission. You know how does bacteria multiply. So the bacteria are multiplying. Within 4 hours, they start multiplication. At 24 hours, they are peak at multiplication. Once the bacteria are at peak, they rupture and they release enzymes. Not rupture, they release enzymes. Bacteria release enzymes. And those enzymes break down the protein, carbohydrate, and fat of the dead body. Our body is made up of three things. The three major components of human body. Human body is made up of protein, carbohydrate, and fat. Yes or no? Carbohydrate give us energy, but the skeleton, the complete structure of the human body is made up of protein, and we have fat as a storage. Yes or no? So all the three things are destroyed by the bacterial enzyme. This leads to destruction of the soft tissue, and this is known as putrefaction. Will you be able to draw this flow chart? It's easy. Okay. So try to say it. Try to see it. You can see. So these are the bacteria. They multiply. In 4 hours, they start multiplication. In 24 hours, they peak multiplication. 4 hour, 24 hour. And once they multiply, they release enzyme. You can see they are releasing the enzymes. And the enzymes are destroying the tissue, the soft tissue in human body. Those enzymes which are secreted by bacteria, they are destroying the soft tissue. Okay, so you got the complete mechanism. So what is happening in the dead body? You tell me what is happening. So after death, the respiration stops. Since the respiration stops, oxygen fall and hydrogen ions are high. It is an ideal condition for bacterial growth. Okay, so bacteria from the intestine, respiratory tract, or wound, they multiply. In 4 hours, in 24 hours, they peak. Then they release enzyme. And those enzymes, the bacterial enzymes, break down the carbohydrate, fat, and protein. This causes destruction of the soft tissue, and this leads to putrefaction. I hope you all got it. This is putrefaction. Okay, which is the main bacteria. Tell me all the name of the bacteria. Learn one bacteria, which is the most common cause of putrefaction, Clostridium velchi, also known as Clostridium perfringens. Velchi and perfringens is one and the same. I hope everyone know. If you have studied microbiology from me, you may be knowing this. Yes or no? Okay. So you can understand this is Clostridium velchi or Clostridium perfringens. This is the most important bacteria, the main bacteria which causes putrefaction. Which enzyme it releases? So as soon as the death occurs, Clostridium velchi present anywhere in the body, maybe in the wound, it multiplies. After multiplication, it releases enzyme. The name of the enzyme is lactithinase. This enzyme is secreted. What does this enzyme do? It dissolves the cell membrane, it digests protein, carbohydrate, fat, and it causes putrefaction. Other bacteria, there are many names. You can read them, but the most important bacteria for your MCQs is Clostridium velchi. People, give me a thumbs up. Are you people there? What happened to my voice, Sanjeev? Am I audible? Am I audible clearly? Yes or no? Say people, am I audible clearly? Yes or no? I guess I am. Use earphones. It will be better if you are using the earphones. My voice is clear. Can someone respond? I'm waiting for your comments. If my voice is clear, I will go ahead. Chalo. So we are done with two things till now. You know the definition of putrefaction. What is putrefaction? It is bacterial destruction of the soft tissue and finally, eventually, skeleton of the dead body. Okay, and you know the mechanism. You will be able to draw the flow chart of the mechanism. Now I'm coming on the features. Features of putrefaction, the third thing. Definition is done, mechanism is done. Now features. There are three features in putrefaction. What are the three features? First, the color change occurs in the dead body. Okay, color change occurs in the dead body. Then gas evolution, gas formation occurs in the dead body, which causes distension of the gas body. And finally, the dead body get liquefied. These are the three main features, the cornerstones of putrefaction. Please learn. What are the three things? First of all, it is color change, then gas formation, and then liquefaction. Please learn it. Okay, so one by one we will take first color change. One by one we will take the three features. Color change. Why color change occur? Now color change occurs externally also in the dead body and in internal organs also. So we will discuss both. External color change, internal. You can make two arrows over here if you wish. So external color change, internal color change. External, internal. Let's start external color change. External color change में bacteria from the bowel invade abdominal wall directly. You can see these are the bacteria in the bowel. The bacteria in the bowel. The most important bacteria which cause putrefaction are the bacteria in the bowel. The bacteria in the bowel, they invade, they come out and involve the abdominal wall directly. They go in the abdominal wall directly, involve the abdominal wall directly. Then they cause destruction of the blood vessels over there. They cause destruction of the wall of the blood vessels so that hemoglobin release out. So the bacteria from the intestinal wall, they invade the abdominal wall. That's what written. The bacteria from the intestine, they invade and go to the abdominal wall directly. After that, what does they do? They diffuse hemoglobin from the vessel. They rupture the vessel walls. Okay, they secrete enzymes, and enzymes destroy the vessel walls, and from which the hemoglobin is secreted, and that hemoglobin is giving reddish brown discoloration in the abdomen. Where in the abdomen? Right iliac fossa. The first sign of putrefaction, the earliest visible sign of putrefaction is greenish discoloration in right iliac fossa. Take my words. What I have said? So it is greenish discoloration in the right iliac fossa, that is known as cecal fossa, the right iliac fossa, cecal fossa. You can appreciate the greenish discoloration over here. Can you appreciate the greenish discoloration in the right iliac fossa? Here also, here also. Later on it spread, but it starts with the right iliac fossa. Okay, greenish discoloration. So why greenish color is formed? Why? Who is forming the green color over here? You're getting my point? So the bacteria in the bowel, they invade, they involve the abdominal wall, they rupture the wall of the blood vessel, hemoglobin is secreted. Okay, this hemoglobin get converted to sulf-methemoglobin, because the colon, the large intestine, contain a gas, hydrogen sulfide. Everyone knows, na? Colon contain gas. The name of the gas is hydrogen sulfide, H2S. Hydrogen sulfide gas is present in the colon. So the hemoglobin which is released, it get converted to sulf-methemoglobin, and this is green color, and that's why the green color. So you get an MCQ on this. Why there is green color in the right iliac fossa in the putrefaction, the earliest sign of putrefaction? It is due to conversion of hemoglobin to sulf-methemoglobin, which is done by H2S. So basically I am saying the bacteria in colon, okay, they invade and come in abdominal wall. After coming in abdominal wall, they rupture vessel, blood vessel. From the blood vessel, hemoglobin is secreted. This hemoglobin gets converted to sulf-methemoglobin by H2S gas present in the colon. This gas, okay, and this is giving greenish discoloration first in the right iliac fossa. So this is what I want to say. I hope everyone got it. Okay, so see the images. I will show you. Can you appreciate the greenish discoloration in the right iliac fossa? Yes, this is the earliest sign of putrefaction. You can appreciate the greenish discoloration in the right iliac fossa, earliest sign of putrefaction. What is the reason for green color? Conversion of hemoglobin to sulf-methemoglobin. Conversion of hemoglobin to sulf-methemoglobin by H2S gas present in the colon. And this sulf-methemoglobin is of greenish color. Okay, I hope everyone got it. So the greenish coloration is not confined only to right iliac fossa. It then diffuses. It starts with that point, but it is diffusing in this manner. It is diffusing in this manner. Okay, so it is starting with right iliac fossa, the cecal fossa. After that, it goes on the liver surface, then gallbladder surface, then the complete abdomen. Then it goes downwards. First it goes upwards, then it goes downwards to the genitals. Then chest, neck, face, limb, everything is involved. You don't have to learn the sequence, but the point is that it is starting focally like this, and then diffusely it is involving the entire body. Okay, that is color changes. So it is greenish color. Initially the color is green. After green, the color changes to purple, and finally the color changes to dark black. So after a few days, 2-3 days, the color will be dark black. Okay, so green color, it starts with green, then purple, then dark black. Okay, what is the time it appears? Finally it become black color, finally. Okay, so it 12 hours, I mean half day, 12 to 18 hours. If it's a range, not take one of them. 12 hours means half day in summers, and 2 days, half day in summers and 2 days in winters. So putrefaction ka time, half day in summers and 2 days in winters. Winters mein it's slow, in summers it's fast. Okay, summers mein it's fast. It is clearly seen in fair skin. Obviously, if the skin is fair, it is clearly seen. You can see here, in fair skin it's clearly seen. In dark colored people, it's difficult to notice, but in fair skinned people it's clearly seen. So these are the features. Okay, one more thing, color changes. I'm teaching you external color changes. External color changes may we have seen the first location. It is iliac fossa, right iliac fossa. Then it diffuses to the whole body. We have seen the color finally converts to black. We have seen the timings also. Okay, now one more thing, marbling of skin. Okay, it is also seen in the external color changes. What do you mean by marbling of skin? What do you mean by marbling of skin? Now, superficial veins. We have superficial veins, na? Especially the leg veins, superficial veins. Okay, superficial veins. In the superficial veins, hemolysis of RBC. The wall of the vein is destroyed by the bacteria. Okay, hemolysis of the RBC leak out. RBC is leaking. That is basically putrefaction. What is putrefaction? In which bacteria is destroying the tissues. So when bacteria destroy the wall of the vessel, blood leaks out. Hai na? So there is hemolysis of RBC, and the RBC, the pigment of the RBC, that is hemoglobin, is infiltrating the vessel wall. It is infiltrating the vessel wall and giving greenish or purplish discoloration, looking like a tree. I mean, how should I say? Listen, these are superficial veins. Can you see? It is not diffuse discoloration like green color. It is like a tree. If you can appreciate, it is greenish color, purplish color, but it is like tree because it is on the course of the superficial vein. And that is known as marbling of the skin. You got it? You can see this. Appreciate the marbling on the breast superficial veins. You can appreciate it well. The tree-like structure. Okay. So the veins, superficial veins, the course of the superficial veins, you can appreciate it here in the leg veins. You can appreciate it here on the chest. So the superficial veins, the infiltration of hemoglobin in the wall of the superficial vein, giving greenish discoloration or purplish discoloration. This is known as marbling. Marbling means like a tree because it is superficial veins. So marbling of skin. You will remember this term, marbling of the skin, you understood? So in external, I taught you color changes. The first location of color changes, right iliac fossa, iliac fossa. Okay, why it is right iliac fossa? You know the flow chart. How does it is occurring? The colon bacteria infiltrate, come in the abdominal wall, rupture the vessel, and hemoglobin is giving this color. Okay, and hemoglobin get converted to matte self hemoglobin by H2S gas, because of which this color comes at this location, and the color is green. So this is the location, this is the color. Okay, after that it diffuses to entire body. Okay, from right iliac fossa to liver to gallbladder to genital to chest to neck to face. Okay, and green color changes to purple and changes to black. So first learn the first location and first color. Then location also changes, color also changes. This is what I taught you, and you know the reason, mainly reason for that. You know the flow chart mechanism. And I taught you marbling of skin. You know what is marbling of skin? Okay, so pigmentation, not diffuse. Here the pigmentation is diffuse. Here the pigmentation is along the courses of the superficial vein. That is looking like a tree-like structure, and that is known as marbling of skin. So this is what external color changes takes place. Now coming on internal color changes. So can I come on internal color changes? So putrefaction, color changes, occurs not only external, it occurs internal also. Internally also, the blood vessels get destroyed and internal organs get colored. So first internal organ which get colored is aorta ki inner surface. First external is right iliac fossa, and first internal is aorta ki inner surface. So learn the first external and first internal for your MCQs. Okay, so first internal color change takes place in the aorta ka inner surface. You can appreciate. This is the inner surface of the aorta, the root of the aorta, and appreciate the color change over here. Can you appreciate? This is aorta arising from the left ventricle, the root of the aorta. You can appreciate. So aorta inner surface become reddish brown discoloration. After that, all viscera, multiple viscera, there is no particular sequence. Dark brown to red color. Okay, finally they become soft, greasy, and they can't convert it into a liquid mass. You can appreciate the viscera. You can appreciate the viscera inside. All the viscera. You can appreciate multiple internal organs show reddish brown discoloration, and finally they get liquefied. So this is color, internal color change. Okay, one more thing I would like to add over here before I move to the next feature of putrefaction is maggot activity. What is maggot activity? What is maggot, by the way? Maggot. What is a maggot? Maggot is the larva of fly. Have you seen a maggot? These are maggots. Can you see? These are maggots. These are the larva of flies. Larva of flies, makhi, flies को हिंदी में मक्खी बोलते हैं, उसका larva. The larva of flies is maggots. Okay, so dead body attracts maggots. Dead body attracts flies actually. Okay, so flies come, they lay egg will hatch, and larva will destroy the dead body further. Initially, the dead body is destroyed by its own bacteria. This is a dead body. Initially, the putrefaction started with its own bacteria. The bacteria present in the intestine, in the respiratory tract, in the wound, they multiply because of low oxygen. Okay, and they secrete enzyme. Those enzymes is causing destruction of protein, fat, carbohydrate, and the dead body is putrefied like that. It was initial. It was giving color changes. But later on, maggots is adding the destruction. Okay, maggot is external. So within 1 to 2 days, if the dead body is not secured, within 1 to 2 days, flies come on the dead body. Makkhiyan aa jati hain, flies. And once the flies come, they lay egg. Okay, egg will hatch. When the egg will hatch, maggots will come. Maggots don't come on the dead body. On the dead body, flies come. Flies will lay eggs, hundreds of eggs, thousands of eggs on the dead body. When the egg will hatch in next 1 to 2 days, maggots will come out. Okay, maggots will come out, and maggots produce the enzyme. These are the external enzymes. Okay, maggots produce the enzyme. Again, they digest the dead body. Okay, again they digest the dead body. If the temperature is high, it speed up the decay, and maggots creates holes in the dead body. Maggots creates, you can see the maggots in the dead body. They are creating small holes in the dead body, which resemble gunshot wound. Okay, so maggots ka hole resemble gunshot wound. I will teach you gunshot wounds also. Okay, mechanical injuries I will teach you. It's very interesting topic. So this is maggot activity. I hope you all got it. You can appreciate the maggot activity. If the dead body is there for 1 to 2 days, you can appreciate it. Looks like horror, scary. So if the dead body is there for 1 to 2 days, it attracts flies. Flies will come, flies will lay egg, the egg will hatch, the maggot will come, maggot will secrete enzyme, and those enzymes also digest the dead body. Initially also the dead body is digested by enzymes only, but those enzymes were secreted by internal bacteria, and now the enzymes are secreted by maggots. So it is cherry on the top. Okay, add-on feature. Okay, so ultimately dead body was already destroyed by the enzyme produced by bacteria, and now the dead body is also along with that is continuing. Along with that, the dead body is also destroyed by the enzymes produced by the maggot. So this is maggot activity. So we are done with the color changes. Okay, got it everyone? Are you people there? People keep interacting. I mean, give me emojis, thumbs up after every topic, so that I feel that I am teaching and you are understanding. Okay, it's a live class, not a recorded version. Yes. And if you have any doubt, you are writing here. Maybe I'm far from the comment section. If I'm missing it, don't worry. After the end of the topic, I will give you time to ask the doubts. This is not for today only. For everyday class, it will be the same. In between, I will not address the doubts, but it doesn't mean I don't want to do. I don't want to address your doubts. I will address all your doubts, but by the end of the topic, so that it will not interrupt my flow. Okay, got it? So color changes are done. Now coming on guest evolution. I'm teaching you the 3 cornerstones, the 3 main features of putrefaction. We have seen color changes. We have seen external color change and internal color change. Yes or no? External color change may we have seen right iliac fossa and the color is green. Later on, from right iliac fossa it shifts on entire body, and the color also changes from green to purple to red to black, like that. And internal may, the first organ is internal surface of the aorta, and after that multiple viscera is involved, and the viscera get liquefied. Finally everything will get liquefied. Okay, apart from that, I told you maggots also here. You know, maggots are also destroying and doing the color change. Now coming on gas evolution, gas formation. Dead body form gas. Yes, dead body form gas. How does? I will tell you. You know what is the most common bacteria? I told you the name of that bacteria now. The most common bacteria which is producing enzyme and responsible for putrefaction. Name the bacteria. I told you now. Clostridium welchii, Clostridium perfringens. It's a gas forming bacteria. Yes or no? I told you microbiology people. Come on. Yes. So Clostridium. So the main bacteria is Clostridium perfringens or Clostridium welchii. Okay, this bacteria metabolize protein and carbohydrates of the human tissue, dead body tissue. So this is the main bacteria which is causing metabolism of the human body, destruction of the human body. It produces gases. It produces carbon dioxide, hydrogen, methane gas, H2S, hydrogen sulfide, ammonia, phosphine, mercaptan gases. All these gases are produced by the bacteria. They give a crepitant feel. You know, crepitant like a balloon, spongy feel. The word is crepitant. It's like a spongy feel, and it distends the dead body. It causes distensions in the dead body. The dead body get distended after few days, few hours and few days. I will tell you the timing. This is gas formation in the dead body. Okay, now because of gas formation, learn 7-8 features. One by one, I will show you the image and the flow chart. Okay, this is basically gas formation. From the gas formation, you can draw 8-9 features. I don't know the number, but there are many features, the many consequences of gas formation. Learn them one by one. So this is how gas formed. I told you the mechanism. How does the gases form? Because of the bacteria. The main bacteria is Clostridium perfringens, which is a gas producing bacteria. So when it causes metabolism of the protein and carbohydrate, it produces multiple gases, because of which the dead body distension of the gas body. Okay, distension of the dead body. Okay, now gases collect in the intestine. First of all, within a half day or 2 days. Again, the same summers and winters. In summers, it's fast. In winters, it's slow. Half day or 2 day. Half day or 2 day. Gases collect, first of all, in the intestine. So, dead body, abdomen distant. Dead body, abdomen distant after half to 2 day, depending on the season when the death occurs. Okay, if the death is occurring in summer, so abdomen distant in just 12 hours. Okay, after death. And if the death is occurring in winters, so abdomen distant after 2 days. So first of all, because the gas is distending the intestines are in the abdomen, so it leads to abdominal distension. First thing. Okay. Second thing you learn, in the eye is also gas is produced. Okay, so because of eye is like a ball, no ball. It's like a curvature. It's like a curvature. It flattened. First, it becomes flattened. The cornea flattened. You can appreciate the cornea, the flat cornea. Cornea become flattened, and sometimes because of the gas, rupture. Eyeball rupture in a dead body. Appreciate the rupture. Appreciate the protuberance of the tongue. Appreciate the rupture. The eyeball is completely ruptured inside. Inside the eyeball rupture, if we are looking, we are getting only blood, clotted blood, no eyeball. So it is already ruptured. Okay, so eyeball can collapse, can rupture because of the gas. Okay, so that is the second thing. So we have seen intestine distend, eyeball become first flattened, collapse. The third, gas, gas in the vessels and the tissue forces the fluid under the skin. Okay, so in the viscera, the gas is there, in the tissue, in the gas is there. So it forces the fluid. It forces the fluid. The gas is forcing the fluid to go in the skin. So skins have blisters, which contain the fluid, serous fluid. So blisters are there on the skin. So blisters with clear reddish fluid or reddish fluid. It don't contain gas. It contains fluid. Okay, so fluid is forced by the gas. So inside this skin, we have tissue. So gas is there in the tissue, which is forcing the fluid in the skin and which is giving these blisters. Appreciate. So there are blisters in the skin, mostly on the trunk, thigh, and hypostatic regions, the stained regions. So that is blisters on the skin. The next is, this is all due to gas. So what we have learned, first of all, abdominal distension, then cornea flattening, then we have seen blisters in the skin. Now fourth thing. What is the fourth thing? Gases give crepitant feel. This I already told you. The complete body bloats grossly. Grossly, you can see the complete body, not only abdomen. The complete body is bloating because of the gases. Okay, complete body is bloating because of the gases. Okay, now gases in the abdomen shift the diaphragm upwards. Have not put the diagram. You can imagine here is abdomen. There is gas in the abdomen first. It is forcing the diaphragm upwards. When the diaphragm is forced upward because of gas in the abdomen. Gas in the abdomen forcing the diaphragm upwards. So diaphragm is pushing upwards, so lungs and heart is pushed. The lung and heart is compressed. When the lung and heart is compressed, pulmonary and pharyngeal vessels are ruptured. The pulmonary vessels in the lungs are ruptured. Okay, and blood-stained frothy fluid comes from the mouth and the nostril. This is known as postmortem purge. What it is known as? So sometimes from the dead body, blood can come from the mouth and the nostril, and this is known as postmortem purge. So gases in the abdomen is responsible for this phenomenon. Postmortem purge. What it is known as? Postmortem purge. Why it is there? Because of the gases in the abdomen, which is pushing the diaphragm upwards. Because of pushing of the diaphragm upwards, the lungs and the heart get compressed. So the arteries can get ruptured, and the blood tinged fluid coming out from the nostril and the mouth. And it can be mistaken for bleeding, for the bleeding following the antemortem. Okay, so it is postmortem purge. Got it? So this is again due to gases. This is due to gases in the abdomen. So next thing, gas pressure can change the location of the hypostasis. Hypostasis location, I told you, no, it depends on the position of the dead body, in supine, in prone, in lateral, in hanging. I told you yesterday, in inversion, all the things. So hypostasis location, distribution tells us the position of the dead body. But because of the gases, it can shift from here to there. The hypostasis can also shift from here to there. Okay, and because of the gases in the abdomen and the reproductive tract, There can be rectal prolapse or uterus prolapse. Appreciate the rectal prolapse in a dead body. Appreciate the uterus prolapse. It is not a real diagram. It is so much prolapse. It is a small prolapse maybe. So uterus prolapse, rectal prolapse can occur in the dead bodies because of the gases in the abdomen. Okay, so this all can happen. One more thing. Suppose there is a pregnant lady who is having fetus in the uterus. Okay, so gas pressure can compress the uterus, and in a dead pregnant lady, postmortem fetal extrusion can occur. The lady is dead. The pregnant lady is dead. Okay, and she is having uterus. She is having a fetus in her uterus. So this is the uterus. You can see, and imagine this is the fetus inside the uterus. This is the fetus, and this lady is dead. Now, because of the gases over here, the gases are compressing the uterus, and fetus expulsion can occur in a dead pregnant lady. This is known as coffin birth. Obviously, fetus is also dead because the mother is dead, the placental circulation has stopped, but this birth is known as coffin birth. Everyone got it? This birth is known as coffin birth. So, yeah, so these are the features. One more feature, skin slippage. The gases separate epidermis from dermis. Gases separate epidermis from dermis. You can see epidermis is separated from dermis. Gases separate epidermis from dermis. Large blebs are formed between epidermis and dermis, and clear fluid is filled between epidermis and dermis. Okay, and when dries, it becomes yellow color, and it is giving an appearance of glove and stocking. Can you see? On the hands and feet, it is giving appearance of glove. It is giving the appearance of gloves. We wear gloves in winters, na? Glove and stocking. So this appearance is known as glove and stocking. This is again due to gases. So can you enumerate all the features you remember due to the gas? First of all, abdominal distension within half day to 2 day, depending on the season. After that, IMA, cornea flattening and collapse. After that, there were many, na? You can remember. We will revise like this. Sure. One by one, you remember. First, abdominal distension. First, you learn how gas formed. It is because of Clostridium perfringens, which is digesting the proteins and carbohydrates and producing multiple gases. There is no one gas. All these gases are produced. That is causing distension of the dead body. So first, only abdomen distend. Then the eye. Okay. Then the blisters on the skin. You don't learn in a sequence. You can say haphazard also, but first is abdominal distension. You learn that. After that, you can follow any sequence. After that, eye is there. After that, blisters on the skin is there. After that, complete body distension is there. The body is bloating like that. After that, you can say the postmortem purge is there. You can explain why the postmortem purge is occurring. The shifting of the hypostasis is there. That can mislead the expert, the forensic expert later on. Prolapse of the rectum, prolapse of the uterus. Not only this, coffin birth. You should be able to explain what is coffin birth. Okay. And skin slippage because of the gases, which is giving the appearance of glove and stocking pattern, you can say. So all these features you have to enumerate. It is due to gas evolution. You can get MCQs also. Everyone give me a thumbs up. We are done. Yes, can we go ahead? Are you people there? Just a second. Yes, so we are done with color change. We are done with gas evolution. Color change mein I told you in external color change, internal color change. External color change में right iliac fossa greenish color, the start point, and internal में internal surface of the aorta, okay, reddish brown color. You know the reason, flow charts, mechanism. Apart from that, I told you maggots also here. Maggots also I told you here. Okay. Then in the gas evolution, I told you multiple things in the gas evolution. Now can I start the third thing? Liquefaction. Yes, I shall start. So let's start liquefaction of tissue. Can I start? Yes. Liquefaction of the tissue. Okay, finally, the third important feature of putrefaction. Forensic medicine is very easy. Actually, it's factual. Many students commented or saying that, ma'am, forensic medicine and PSM, these two are very factual subjects. What you are going to teach in us. So if it is factual, you can learn of your own. But here my thing is that, my job is that I can show you multiple images. These images are not given in any book, anywhere. I have accumulated it from multiple sources. I show you here one slide. I hardly stay on that slide for few seconds, maybe for 2, 3, 4, 5 seconds. Okay, not, but for making this slide, I need more time. So I spend more time in making each slide to make these flowchart, to put arrows, okay, to convert paragraphs into bullets, into flowcharts, and put the corresponding images from multiple sources I collect. And then I present in front of you so that it fits in your mind. Okay, if you read the paragraph, it's not going to fit in your mind. You will understand, but you will not be able to recall. But in the form of the flowcharts and bullets and basically images, you will retain it better. That is for sure. So I agree these two subjects are more of factual, but I assure you each and every fact fit in your mind in these classes only. Okay, and the remaining two subjects, surgical subject, they are conceptual. You have to understand the surgeries. I will show you with 3D models, each and everything there. Anyways, come back. So let's move on the third thing, that is liquefaction. Can we start liquefaction? Yes, let's start it. You keep on revising the last two. Coming on the third feature of putrefaction, liquefaction. Finally, liquefaction. Have you studied pathology from me last year when you were in second prof? I guess many students are pre-existing users. Yes or no? So I taught you the necrosis. What are the 5 type of necrosis, people? You may have seen this slide if you have read pathology from me. So these are the 5 type of necrosis. Now, coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, or fibrinoid necrosis? Yes or no? These two are special type of necrosis. Everyone knows. And these 3 are the main necrosis. What is the meaning of these 3? What is the difference of these 3? You can understand. You may have seen this also. I have explained you very well in second prof. Yes. So what are the 3? These 3 main necrosis. Coagulative necrosis, liquefactive necrosis, and caseous. Currently, I am interested in liquefactive necrosis. Liquefactive necrosis in the dead body leading to liquefaction of the tissue. So basically, liquefaction of the tissue is due to liquefactive necrosis, also known as colligative necrosis. Coagulative necrosis, second is liquefactive. Liquefactive also known as colligative necrosis. This one, the second one, this one is responsible for the third feature of putrefaction, that is liquefaction of the dead body. Okay, so this is the necrosis. I hope everyone got it. Huh? You can see the 3 type of necrosis. Here, what is happening in liquefactive? In coagulative, the cell margins architecture is intact. Only the cytoplasmic detail is lost. But this one is not happening here. In the liquefactive, the complete cell is lost. I mean, its architecture is also lost. Its cytoplasmic detail and nuclear detail, all the things are lost. And ultimately, it gets converted into a liquid. That is liquefactive necrosis. So after 5 to 10 days of the death, not immediately, not after 2 days, half days, you have to learn these timelines. After 5 to 10 days, after death, liquefactive necrosis of the dead body start, and that leads to liquefaction of the tissue. So I guess you know the reason of all 3 now. What is the reason for color change? What's the reason for the color change? It is the bacterial enzymes which is causing degradation of the vessel, which is causing release of the hemoglobin, and hemoglobin get converted to self-meth hemoglobin by H2S gas, and that is giving the color change. What is the reason for gas evolution? It is Clostridium perfringens, which is digesting the human tissue, carbohydrate, protein, and forming the various type of gases. You know the reason. You know the name of the gases. And what is the reason for liquefaction of tissue? Liquefaction of tissue is due to colligative necrosis of the dead body after 5 to 10 days of the death. Okay. Okay. So that is the reason. Now, tell me the features of liquefactive necrosis. The complete abdomen burst. Sometime in the dead body, the abdomen burst because of liquefaction. The complete abdomen burst. Everything get liquefied inside. Abdomen burst, stomach, intestine can protrude. In children, thorax can also burst. Thorax is also soft, ribs are soft, and that can also burst. The complete fat liquefies. It becomes translucent yellow color. All the internal organs are soft and black. They are black because of putrefaction, but they become soft and liquefied. Okay, if it's a small fetus, it is completely liquefied. Okay, and cartridges and ligaments are last to liquefy. So these are the features of the liquefaction. You can say everything is getting liquefied. Okay, eyeball can also get liquefied. So this is the third and the last feature, that is liquefaction. So we are done with the first thing, putrefaction. Today I am supposed, no, not done. The features are done. Okay. So features of the putrefaction are done. The 3 features. You know color change, you know gas evolution, and you know liquefaction. You know the reason of all 3, features of all 3. Okay, try to summarize it here only so that you don't have to read such a text. You can summarize it here. Now, I was teaching you putrefaction under these headings. Okay, can we revise it? I already taught you the definition. What's the definition of putrefaction? Bacterial destruction of the dead body. Or you can say bacterial destruction of the soft tissue followed by skeleton of the dead body. Bacterial destruction. Okay, mechanism I already explained you, the flow chart, and the 3 features we have just completed over here. You can see the 3 features we have just completed. Now I'm coming on distribution of the putrefaction. Distribution of the putrefaction. Tell me the sequence in which putrefaction occurs, the distribution. Okay, after that I will tell you the factors affecting rate of putrefaction and some small terms like what is odor mortis, putrefaction in water, skeletonization, all these. So first coming on the distribution of putrefaction. Distribution of putrefaction, it starts with abdomen. I told you, na, right iliac fossa. It starts with right iliac fossa, then complete abdomen. Okay, so first it starts with abdomen. Okay, then it moves to the chest, then it moves to the neck, then it moves to the face, then it moves to the legs. Okay, and then shoulders, and then arms, then shoulders and arms. You can learn the sequence if you wish. If you can't learn the sequence, learn the starting point. Putrefaction externally start from abdomen. If you can learn complete sequence, it's well and fine, but nobody is going to ask, at least in MCQs. For university exam, if you can write down, very good, you will get good marks. But you can't forget the first thing to start. So putrefaction externally start with abdomen, especially right iliac fossa, thecal region, abdomen. Then complete abdomen, then it moves to the chest, then move to the neck, then face, then shoulders, then arms. So this is the usual sequence, but it depends on the temperature, body to body. There are many factors that will come on that. This is the external order. Internally, it start with larynx and trachea. The putrefaction start with larynx and trachea. You can appreciate here, larynx and trachea. Okay, after that it goes in the abdomen, stomach, intestine, pancreas, spleen, then liver, lung, brain, heart, kidney. Don't learn the complete sequence, but just starting from larynx and trachea. So this is the internal sequence of the order of putrefaction. Fastest putrefaction, fastest occurs in larynx and trachea, and slowest occurs in bones. You can learn like that, the fastest and the slowest internal organs. So that is the distribution. Now coming on the factors affecting rate of putrefaction. What are the factors? There are two types of factors: external factors, internal factors, which affects the rate of putrefaction. So external factors are 5, internal are 3, so total 8. 5 plus 3, 5 plus 3, 8 factors are there. 5 are external, 3 are internal, total 8 factors. You try to learn. Okay, what are the 5 external factors? One by one we will take. So let's start with external factors only. First is temperature. Temperature affect putrefaction? Yes. Below 10, it don't occur. I mean, it begins when the temperature is more than 10 degree. When the temperature of the dead body is more than 10 degree, then it begins. It is optimum 21 to 38. What is human body temperature? It is 37 degrees Celsius. But after death, the dead body start cooling. Yesterday I taught you rigor mortis. So it loses heat till it reaches the temperature of the environment. Yes or no? So 21 to 38 degrees, it's optimum. And below 0 and after 48, it don't occur. Putrefaction occurs optimum. It's optimum at 21 to 38. Okay, just a second. It's interrupting the digital board. So putrefaction is optimum at 21 to 38. Okay, and below 0 and above 48, it don't occur. Below 0, above 48, it don't occur. Rate doubles every 10 degree rise. Okay, these are the features of the temperature. Coming on moisture. Moisture is essential for putrefaction. Dryness arrests putrefaction. Moisture is essential. That's why putrefaction is very fast when the body is taken out from, in case of droning, taken out. In water, putrefaction is slow, but once the body is taken out, it's very fast. In edematous body and droned dead body, the body which is droned, then it is exposed to air, it's very fast. Okay, that is moisture. Air is very essential. Okay, bacteria will survive in presence of air only. So air is essential for putrefaction. Clothing will increase the rate of putrefaction or decrease the rate of putrefaction. Initially, clothing hasten the rate of putrefaction. It is hastening because it is providing heat to the body, na? And in heat, the bacteria will survive better. Putrefaction is all about bacteria. Okay, bacteria need air, bacteria need moisture, bacteria need adequate temperature. At low temperature and high temperature, bacteria can't survive. So if bacteria survive at optimal temperature, putrefaction is maximum. Moisture is essential for bacteria. Air is essential for bacteria. Clothing provides heat to the dead body. If the dead body is covered with the cloth, blanket, so it provides heat to the dead body. Okay, so it is good for the bacteria. So putrefaction is fast. But later on, it resists the entry of the maggots. Huh? If the dead body is covered, flies cannot come. You know, I told you, no? After 1 or 2 days, flies comes on the dead body and then they lay eggs and maggots come. So insects ka entry is blocked by the cloth. So later on it delays putrefaction, because putrefaction is due to 2 things. First, it is due to bacterial enzyme. Later, it is due to the enzyme secreted by the maggots. Got it? So clothing can hasten initially because it provides heat. Later on it delays because it blocks the entry of the insect. Okay. On a naked dead body, the insect entry is easy. Okay, the next is burial. The dead bodies are buried. Okay, sometime it is buried, sometime it is burned, depending from caste to religion. There are many ways for the last ritual of the dead bodies. So burial, in case of burial, so burial is shallow or deep. Putrefaction will be fast where? So bacteria survive better in shallow, because shallow burial are damp. If the burial is very deep, it will be dry. So shallow, if burial is shallow, superficial or shallow, putrefaction is fast. If burial is very deep, the soil is dry and putrefaction will be slow. So everything is common sense. You don't have to learn. Putrefaction depends on soil to soil. There are various types of soils in which the burial of the dead bodies is done. So it is fastest in the marshy soil. Okay, and little bit less than that, faster in the porous soil. Okay, and this acid, if the soil contains acid, it can destroy even bones. Okay, so it depends from soil to soil. That is the burial. So these are the factors, the 5 factors, external factors, which decide the rate of putrefaction. Temperature may, optimum temperature is 21 to 38 degrees Celsius. Below 0 and after 48, it is arrested. It don't happen. Putrefaction don't happen because bacteria can't survive. Okay, moisture is essential. Air is essential. Clothing initially increase the rate of putrefaction because it provides heat to the body, and later on it decreases the rate of putrefaction because it blocks the entry of the insects. Burial में shallow burial, it increases the rate of putrefaction, and deep burial, it decreases the rate of putrefaction. You can write here only like this. Okay, so you don't have to read all these slides. Okay, and depends from soil to soil also. You can learn the soils for your MCQs. So this is the external factors, common sense. Okay, internal factors. Does age affect condition of the body and cause of death affect putrefaction? Yes, age, regarding age. You know, newborn gut, as soon as the newborn is born, if it is unfed, no milk, no mother milk, as soon as the newborn is born and the newborn is dead after birth. Okay, so intestine is sterile. There is no commensal bacteria in the intestine. So there is sterile intestine. If the newborn is born, as soon as the newborn is born and not fed, intestine is sterile. So there is no bacteria. So putrefaction is very slow. Okay, and remaining all, the putrefaction is fast because they have bacteria in the gut. So that is the age का importance. What about fat and lean? The person who is fat, the person who is lean, if both of them are dead bodies, so putrefaction will be fast in which? So fat decompose faster. Okay, and fatty body में putrefaction is fast because fat decompose fast. Bacteria can decompose the fat very fast, but in a lean body the decomposition is slower. So putrefaction is fast here in an obese person, in an obese dead body, and putrefaction will be slow in the lean dead body. If you understand the concept, you don't forget, because bacteria can digest the fat faster. More fat, faster digestion, fast putrefaction. Here less fat, so slower putrefaction. Okay, what is the cause of the death? Putrefaction is fast after septicemia, peritonitis, asphyxia, and anasarca, and putrefaction is delayed in all these diseases if you want to learn. Okay, so that is about the factors. We are done with the factors affecting putrefaction. I told you 5 external and 3 internal factors. If you want to learn, you can write down 1 to 2 line on each of them. The factors affecting putrefaction. You can get MCQ on that. You can easily solve that if you get the MCQ. If you can write down 1 to 2 line over here only. Okay, and for your university exam, you can fill at least half or 1 page. Okay, based on the factors affecting putrefaction. Now coming on odor mortis. What is odor mortis? Odor mortis, it's an offensive or sweet smell, offensive or sweetish odor from the dead body due to the typical chemicals which are produced because of putrefaction of the human tissue. So when putrefaction of the human tissue is done, so 50 typical chemicals are produced which are not produced in the putrefaction of other animals. Okay, so that can be detected by the dogs also, the trained dogs. Okay, because they have good smelling power. So dogs can smell and tell the dead body if the burial is shallow. They can smell it. Okay, so that is known as odor mortis. Or there are cadaveric detection instruments also apart from the dog that can detect the smell of these 50 typical chemicals which are produced due to putrefaction of the human tissue. Okay, not due to animal tissue. So this term is known as odor mortis. Okay, now one more thing, putrefaction in water. What happens What happens in putrefaction in water? There is Casper dictum. You learn this name. Casper dictum. Casper have said what? See the ratio. Putrefaction in air is to water is to earth. Earth means burial, deep burial inside the soil. So highest putrefaction occurs in air, on the land, in the air. Okay. Slower than this is in the water and very slow in the burial. That's why the dead bodies are buried at many places, I mean, many religions. Dead bodies are buried because, you know, putrefaction is slower. Putrefaction is slower as compared to air and water. You are getting my point? So this is the ratio you have to learn. Air is to water is to earth. Say the ratio. Air is to water is to earth. So putrefaction is 8 times as compared to burial in the air. In the water, it is 4 times. On the earth, it is 1 time. So here it is 8 times and here it is 4 times as compared to burial. You are getting my point? So same thing is written. So fastest putrefaction is in air. Slower than this is water. And slowest, very slow, is in burial, deep burial. So that is Casper dictum. Okay. So basically what we have learned, I'm interested in water. Water में putrefaction is fast or slow as compared to air? So water में putrefaction as compared to air it's slow, but as compared to burial it's fast. But as compared to air it's slow. So water slows down putrefaction as compared to air. Okay. Now it depends. Is it moving water or stagnant water? The dead body was where? In the moving water, putrefaction is very delayed. In the stagnant water, it is relatively fast. Okay. So that is regarding the water. So that is regarding the water. In the water, you know, many aquatic animals are present, like fishes are present. They can eat the flesh. They can eat the flesh of the dead body. So sometime if the dead body is in water for long, for days or for months, we take out the dead body after that. So we found the flesh is already eaten. The body is not decomposed. The body is not putrefied. Putrefaction is not there. So where is the flesh? Where is the flesh? Is it putrefied? No, the animals have eaten it. I mean aquatic animals. So aquatic animals like fish, crab, rats, they can destroy the flesh. And sometimes there is fungal growth over the dead body in submerged dead bodies. Fungal growth can be there. So we are done. The last thing in putrefaction is skeletonization. So this was all about soft tissue. Okay. The soft tissue is destroying. Does putrefaction destroy bones also? Yes. Okay. So this is known as skeletonization. It varies with temperature and insects. How many insects are there? Now listen. If the hot, humid climate is there, complete skeleton in few days. But dead bodies are not kept in hot, humid climate. No, dead bodies, the last rituals are performed as soon as possible. Either they are buried or they are burnt. Okay, whatever is the last ritual. They are not kept in the hot, humid climate. Otherwise, in few days only, the complete skeletonization will be there. Putrefaction will be very fast. Okay. If the body is exposed to flies, ants, dogs, or vultures, they will within few days only, they will take out all the soft tissue and skeletonization is there. Okay. In buried bodies in India, I'm talking about Indian soil. In buried bodies, skeletonization occurs in 1 to 2 years after burial. Okay. And sequence of disarticulation, first of all, the head disarticulate, then trunk disarticulate, then limbs disarticulate in a buried body. I'm not talking about the burnt, I'm talking about a buried body. And bone decay takes 10 to 12 years. So that is about the skeletonization and we are done with putrefaction. Today I'm supposed to teach you 3 topics. One of them, the biggest one, is done. Now these 2 are small and relatively small and easy to understand. So putrefaction is done. Yes or no? Can we revise it quickly? Yes, we can do so. So if putrefaction, long question coming in your exam, can you write your answer under these headings? Yes. Can we revise these headings quickly? Yes. What's the definition of putrefaction? It is bacterial destruction of the dead body. Bacterial destruction of the dead body. Okay, what is the mechanism? You know the mechanism? The bacteria which are present in intestine or respiratory tract, they will invade out in the soft tissue. They will release the enzyme and those enzymes are causing the destruction. First, they will multiply because oxygen is less. I've told you the complete flow chart. Okay, now 3 main features. Color changes external, right iliac fossa, greenish color. Internal में aorta, internal surface, the reddish brown color. You should appreciate the maggots also. The maggots also add on the you can put the maggots in the mechanism only if you wish. So maggots also add on in the putrefaction apart from the commensal bacteria. Okay. Second is gas evolution. Gas evolution, I told you many things. Now, first abdomen distend, then eye, then blistering of the skin, then prolapse of uterus, prolapse of rectum, postmortem purge, that is bleeding from the nose and the mouth. This all due to gas evolution. Liquefaction, mein, you know the reason for liquefaction. It's colligative necrosis. Out of the 5 type of necrosis, which necrosis? Liquefactor or colligative necrosis is responsible for liquefaction, and all the things get liquefied one by one. Okay, distribution, mein, you know the distribution of external of organs and distribution of internal organs. External mein first is abdomen, and internal mein first is larynx and trachea, and last is bones. If you wish, you can learn the complete sequence over here. Factors affecting putrefaction, mein, I told you external factors which are 5 in number, and internal factors which are 3 in number. They all were common sense, you can understand. Order mortis, you know, it is a peculiar offensive or sweetish odor which comes from the 50 typical chemicals which are formed during putrefaction of the human tissue, and that can be detected by cadaveric instruments or dogs. Okay, and then putrefaction is water is slow as compared to air. You know the Casper dictum, 8:4:1. Air is to water is to earth. Okay, and last is skeletonization. So this is how you can frame your answer. At least you can write down 4-5 pages if it is a long question. If it's a short question, they will ask you a peculiar portion. You have to write down that only. And MCQ 100% done. Try it out now. Try it out. Whether I say you try by your own. Okay, putrefaction is done. Can I come on the second feature? I mean, second postmortem change. Late postmortem changes. My first is done, putrefaction. Now, second is adipocere formation. So let's start the second. That is adipocere formation. What is adipocere? If adipocere is coming as a long question, or usually it is not long, it is asked as a short question, you have to frame your answer under these headings. So first of all, you tell me adipocere is also known as saponification. Saponification of the dead body. Okay. So first you tell me the definition. Obviously, then you tell me the mechanism. Okay, then factors affecting the formation of adipocere, properties of adipocere, distribution of adipocere, and what is its medical legal importance. So one by one we will see what is the definition. What is adipocere? First of all, the remaining two, these two are modifications of putrefaction. They prevent putrefaction, both of them. Adipocere formation as well as mummification. They prevent putrefaction. They are modifications of putrefaction. Okay, so adipocere formation, in the introduction itself, you can write down it's a modification of putrefaction. It's a modification of putrefaction in which the body fat, the dead body have fat, all human body have fat, whether obese or thin. So body fat, this full sleeves now, it interact with the digital board and changes the slide again and again. So this body fat get converted to waxy, greasy, soap-like substance, and that is known as adipocere. Can you see? This is adipocere formation. So in the dead body, whatever fat is there, the fat in the dead body get converted to waxy, waterproof, soap-like material, that is known as adipocere. Okay, this conversion is known as adipocere formation. It is common in the bodies which are immersed in water. Okay, or which are kept in moist environment. Okay, and it represents chemical preservation of the fatty tissue rather than destruction. So here fat is not destroyed, rather it is preserved. It is saponification of the fat. Saponification of the fat. In putrefaction, the fat was destroyed. The fat is destroyed by the bacteria in putrefaction. Here fat is not destroyed. The fat is preserved. The fat is preserved. That's why I'm saying it's a modification of putrefaction. So you know you have to learn this definition. What is adipocere formation or what is saponification? The body fat of the dead body get converted into waxy, greasy, soap-like substance which is known as adipocere. And this is a definition. Okay, you can see adipocere formation. Okay, so what is the mechanism? Whatever pre-existing fats are there in the dead body, okay, they are get hydrolysis or hydrogenation by the lipase enzyme. Lipase enzyme. The lipase enzyme is secreted after death, and that lipase enzyme act on the pre-existing fat present in the dead body, causing hydrolysis and hydrogenation of those fat and convert them into fatty acids. So pre-existing fat convert into fatty acid by the enzyme lipase. The pre-existing fat in the dead body, you can see this is the dead body, the pre-existing fat converted to fatty acid with the help of lipase enzyme because of hydrogenation and hydrolysis. So that is the main mechanism. Now, these fatty acids combine with calcium and ammonia ions and form the soap, form the water resistant soap, and that is known as adipocere. That is known as adipocere, and that inhibit putrefaction. Okay, that inhibit putrefaction. So see the complete mechanism. I know it's factual, but I'm trying to retain it with the help of images and flowcharts. So this is a dead body. In the dead body, there is fat. Okay, we will draw. In a dead body, there is fat. That fat is converted to fatty acid with the help of lipase enzyme. This lipase enzyme causing hydrogenation and hydrolysis of the fat, converting it to fatty acid. This fatty acid combined with calcium and ammonia ions, and now it is known as soap. It is known as soap. Soap or saponification. It is waxy, greasy, water resistant. Okay, and it inhibits putrefaction. It inhibits putrefaction. This is how you have to draw it and understand it. Okay, you can see. So body fat, lipase is acting on it, converting it into fatty acid. Fatty acid combined with ammonia, calcium, and form a soap, water resistant soap, saponification. Learned it? This is the mechanism. So mainly mechanism is asked. Mainly the definition and mechanism. That's what you have to learn. Okay, water is essential, which is required for hydrolysis of the fat. Without waters, adipocere formation cannot occur in dry environment. And first of all, it occurs in subcutaneous fat and then deepened tissue. So it starts with the subcutaneous fat, then deepened tissue. So it is preventing putrefaction. It is preserving the dead body for longer. Okay, that is adipocere formation. Okay. What are the factors influencing? The most important factor is water. The major factor is water. In presence of water only it occurs, because in the formation we require hydrolysis. Hydrolysis is because of water. So fats, hydrolysis of the fat because of lipase will lead to fatty acid. If there is no water, there is no hydrolysis, so fatty acid will not form. So the major contributor here is water. Then second is temperature. We know in warm environment it's faster, in cold environment it's slower, like all other things. Then body build. It is more common in obese. Common sense. Obese have more fat, that's why more common. Okay, side. It occurs in the bodies which are submerged in the water. Okay, and it starts after 4 to 5 days. So that is the factors affecting property. Tell me the color. It is whitish to pale yellow. Appreciate. It's whitish to pale yellow color. What was the color of putrefaction? It started greenish. You know the reason for greenish. Typical greenish color. Because of sulf-math hemoglobin formation. And here the color of the soap is white to pale yellow. Later on it convert to brown. Okay. The texture is soft, greasy, waxy. Have you seen a wax? Soft paraffin wax. It's like that. It's soft, greasy, waxy initially. Later on it becomes hard and brittle. And odor is ammonia. Ammonia odor. The smell is like ammonia. When urine is retained in the bladder for very long time, then ammonia is generated in the bladder, and then after with the full bladder or holding the urine for very long, when the urine is passed, there is a peculiar odor comes. That is ammonical odor. So same odor comes from the dead body if adipocere is formed. Okay. Inflammable? Yes, it burns. It burns. It is inflammable. It burns. Okay. If a matchstick is put, the complete body can be burnt. It's inflammable. The adipocere is inflammable. Okay. It floats in water and it persists for decades. It prevents putrefaction for decades. For decades, the dead body is preserved. I mean, putrefaction destroys the dead body. Na? Adipocere is preserving it. Okay. So adipocere formation only if water is present around the dead body, moisture is present. Distribution, I told you already, it starts in subcutaneous fat. Subcutaneous fat of face, cheek, breast, abdomen, buttocks, thigh, and limbs. So maximum fat is present where? Subcutaneous fat. Okay, and then it goes to the deep fat of internal organs. So that is a distribution. Okay, and epidermis disappear. Later on, epidermis disappear and dermis darken. You can see in extensive case, the entire body converted into adipocere. The entire dead body converted into adipocere. It start like this, and then entire body converted into adipocere. What's the medico-legal importance of adipocere? Is it important? Yes. It preserves the body features, and it is required for identification. In case of unknown dead body, unidentified unknown dead body is found after many days of the death from some forest or submerged in some water, in some lakes like that. So in medico-legal cases, it's important for identification. If adipocere is formed, putrefaction will not happen. Putrefaction destroy the features. It is preserving the dead body. So it's the most important medico-legal importance is preservation of the body features, which is useful in identification in medico-legal cases. Okay. It preserves the wounds and fractures also. So it helps us to determine the cause of the death. Okay, whatever is the wound, it will also preserved. Okay, whatever is the fractures, that will also preserved. Putrefaction destroy everything. After 2-3 days, putrefaction start and it destroy everything. But here it is preservation. Okay, and it indicates post-mortem interval based on which we can tell the approximate time of death, and it suggests the dead body was in moisture after death. Okay, so this is the medical legal importance. Learn 4 points medical legal importance of all the things you should know. You should be able to write, because what we are studying, what is the subject? Forensic medicine. Why my first slide every day I show you for forensic medicine is medical legal importance. So forensic expert helps the police to tell answer of two questions: how the death occur and how long is the post-mortem period, when did the death occur. So for answering these two questions, this medical legal importance of all the things you should be able to know. So medical legal importance is very important. Okay, am I not audible? Harshita, am I not audible? Others, kindly respond. Am I audible or not audible? Can you please respond, everyone? Am I audible or not audible? Is audibility is an issue? Many students sometimes say I am not audible. What is the issue? I don't know. I'm audible now. Okay. So what is the problem? Can we go ahead? We are done with adipocere formation. Can we revise it quickly? Adipocere formation is done. So adipocere formation under these headings. Okay. What's the definition of adipocere formation? In adipocere, the fat of the body, dead body, get converted into adipocere. What is adipocere? Adipocere is soap, saponification. It's waxy, greasy, water-resistant soap, and that is known as adipocere. How does it occur? You know, the fat get converted to fatty acid because of hydrogenation and hydrolysis by lipase enzyme. And this fatty acid combined with calcium and ammonia, and it forms the soap. And this soap is known as adipocere, and it prevents putrefaction. Easy. The factors I told you, the 5 factors, you please learn the same: temperature, moisture, lean and obese body, the same factors. Okay. Properties of adipocere: tell its color, tell its texture. The color is yellow, white, the texture is greasy. Okay, so you have to write down all the properties. Distribution: it starts with subcutaneous fat of cheek, face, breast, buttock, thighs, and then it goes to deep fat of the internal organs. Medical legal importance: learn the 4 points of medical legal importance you already know. Coming on the last thing for today, mummification. Can I start mummification quickly? Okay, so mummification. What is mummification? It is a short note. If you're getting a question on mummification, you have to write down your answer under these headings. First of all, tell me definition of mummification. What is mummification? Then mechanism. Everything will start with definition and mechanism. These two headings are common in all, whether it is putrefaction, adipocere formation, or mummification. So these two headings are common: introduction, mechanism. Okay, introduction, mechanism, features, time required, and medical legal importance. One by one we will see. What is mummification? Mummification is evaporation of water from the dead body. If the dead body after death, it is kept in a very dry, hot environment, in absence of water, very dry environment. So complete dehydration of the dead body because of evaporation of complete water from the dead body. From the dead body is complete water is evaporated. There is no water inside the dead body. 100% dehydrated. So for the first two things, water is essential. I told you, for putrefaction as well as adipocere, for both of them, water is essential. So they both can't happen and mummification will occur. So mummification again prevent putrefaction. It preserves the features of the dead body. I hope you are getting it. So what was putrefaction? Bacterial destruction of the dead body. Okay, what is adipocere formation? Adipocere formation is conversion of fat of the dead body into a soap-like material. What is mummification? It is dehydration of the dead body, drying and dehydration of dead body because of evaporation of water. So these two are modification of putrefaction which prevent putrefaction. Okay, so mummification, it's complete dehydration and drying of tissue due to evaporation of water. It's a modification of putrefaction. Okay, body becomes dry. You can see the dead body become dry here. Okay, it become dry, leathery, light. The weight is reduced, the dead body weight, because the water evaporates. Okay, and it is shriveled, but maintain the general form and features. You can see the general features can be identified. The general features can be identified. So what is the mechanism? How does mummification takes place? What is the mechanism of mummification? When the dead body is exposed to hot, dry air. Okay, now which one is fast? Is evaporation is fast or bacterial activity is fast? So inside the dead body, the bacteria are already present. Okay. But if evaporation is faster rate as compared to bacterial activity, then putrefaction will not take place. Mummification will take place. So after death, there is a competition between the two. Is evaporation is at a faster rate or bacterial activity is at a faster rate? If evaporation is not faster, the body is in humid environment, or it is in winters, it is in humid environment. Okay. So bacterial activity will fasten. In that case, putrefaction will go. Okay. But if evaporation is fast, if the dead body is in very hot, dry, desert area, and in that case bacterial activity will not be very fast. I told you, bacterial activity optimum temperature is 21 to 38 degree. If the temperature is more than 38, so bacterial activity is not very high. Okay, after 48 it is 0, 48 degree. 38 to 48 it is very less. So in summers the temperature sometimes touch the 40s 50s. In that case, if the dead body is kept in open in summers in dry environment, then evaporation of the dead body occurs. Okay, evaporation of the dead body occurs, and evaporation of the dead body is more than bacterial activity. It causes rapid evaporation of the water. It causes rapid evaporation of the water, and bacterial activity is suppressed. Evaporation is fast, bacterial activity is low. So tissue desiccate before it decomposes. You have to learn this line. Tissue is desiccating before it decomposing. Putrefaction decomposes the tissue, and this one is desiccating the tissue. So tissue get decimated and mummification occurs. I mean, the body convert into a mummy. This is known as mummification. The body converted into a mummy. A dead body with dehydrated, complete dry dead body I'm sorry, is known as mummy. This is known as mummification. Everyone got the mechanism? Give me a thumbs up. I will work on the sound. Many students are saying, no, audio is the problem. Will call my tech person tomorrow to set my mic, or if required, I will change it. But give me a day. Tomorrow we don't have any class, so tomorrow I will work up on the sound, and I'm assuring you that the next class you will not face this problem. Okay, currently I will go with the same settings, because if I change the setting, class will not be continued. I guess you can understand. I mean, the voice is not very less. Yes, can I continue the class with the same setting? In the next class, I will try to change the settings with my tech person. Okay, can we continue? Sure. Yes. So this is the mechanism. So we are done with definition and mechanism. Definition is dehydration and drying of the dead body. Okay, mechanism, when evaporation exceeds the bacterial activity. So dead body desiccate as compared to decompose. Learn this line. Dead body desiccate faster as compared to decompose, because evaporation is at faster rate as compared to bacterial activity. Evaporation leads to desiccation of the dead body, and bacterial activity leads to decomposition. Decomposition is the other name of putrefaction. Okay, getting it? This leads to mummification. I hope everyone got it. What are the features? Now enumerate the features one by one. Okay, it start at the exposed part. I cannot tell you one part. Like for putrefaction, I told you this one start at right iliac fossa. Externally and internally, it starts in larynx and trachea. Adipocere, I told you, it starts in subcutaneous tissue of the face, cheek, buttock, thigh, breast, wherever fat is there. Mummification, there is no fixed area. Exposed portion of the body. So it starts at the exposed parts of the body, like face, hands, and feet, usually not covered with the clothes. So it starts at this point, and later on it extends to the whole body. Okay, including internal organs also. So this is the features. The skin of the mummy is dry, brittle, leathery, and parchment type. The color is brown to black. Okay, there can be fungal growth on the surface. That's it. Body weight reduced by 60%, 60 to 70%. Suppose there is a person whose weight was 100 kg at the time of death. Okay, so after death, after mummification, it will be only 30 kg or 40 kg. The remaining one is lost, okay, in the evaporation. So rate is reduced by 60 to 70% because in human body 60 to 70% is water, and that is evaporated. So weight reduction, significant weight reduction is there. Limbs are thin and rigid. You can appreciate the limbs. They are thin, they are rigid. Muscles are contracted. The muscles are contracted. So usually elbows, knees, and fingers are flexed. It's not very good visible here, but the elbows are flexed. Okay, flexion is there. The muscles are contracted. Internal organs are shrunken. You can appreciate all the internal organs not visible over here, although they are shrunken, hard, and dark brown color. And insects there is no maggot. Maggot occur in putrefaction. Here moths and larvae can come. Moths and larvae can come in a mummification dead body. Okay, what's the time required? In dry environment, it requires 6 months. In moderate environment, it requires 12 months. And it persists for years if the environment is favorable. So in dry environment, it's very fast. Mummy is formed in 6 months, and in moderate, it takes 12 months. So you have to learn the time requirement. What is the medical legal importance? 5 medical legal importance. Number 1, it confirms death. Obviously, this person is dead. It is not dead, it is mummified. So it confirms death and postmortem desiccation. Number 1, it preserves the identity. It is preventing putrefaction. It is preserving the identity. We can identify the person from the facial, all the features. Okay. So it preserves identity. It preserves injuries also, like adipocere only. It indicates the body was in dry environment since last months or years. And it tells us the approximate time of death. Okay, so that is the medical legal importance, is same as that of adipocere. You should know the medical legal importance of all of them. You frequently get short or very short question on the medical legal importance of these things. So I always insist to understand the medical legal importance instead of mugging it up. I highlight the main word that you have to keep in your mind. Okay, so we are done with mummification also. I guess you can write your answer under these headings. So we are done with all 3. One more thing I want to teach you. Next 5 minutes, 10 minutes. Wait. First, you see these 3. So if any of the question coming in your exam, long question, short question, will you be able to define the 3? What is putrefaction? Bacterial destruction of the dead body. Adipocere, formation of soap-like material in the dead body. Okay, waxy, greasy, water resistant. And what is mummification? Dehydration and drying of the dead body. You know the mechanism of all, definition is written in front of you. You know the mechanism mainly, medical legal importance, features, factors, you know everything. Yes or no? These are the headings under which I taught you these 3 topics. So before going to your exam, if you are going for a prof exam, you should revise these headings for framing your answer. And if you're preparing for competitive, go for MCQs directly without revision. Okay, got it? You can see we have completed putrefaction, adipocere formation, mummification. Everyone give me a thumbs up. Everyone. Got it? Those who are live, please. Last one topic I want to teach you before leaving. It is also given in this chapter only in the standard textbook. So this chapter will be 100% complete. Okay. Estimation of postmortem interval. How to estimate postmortem interval? That is time since death. What are the ways? There are 12 ways. You get a long question on this. How to estimate postmortem time? The most important job of a forensic expert. Whenever there is a suspicious death in which there is a suspected or multiple suspects are there. Okay, so police call a forensic expert on the crime scene, and forensic expert, the most important job is to tell time since death. Okay, so how the forensic expert reach on some conclusion? Suppose we all are forensic experts and there is a suspicious death. Okay, and some unnatural conditions, and there are multiple suspects the police is having. Okay, like a movie story, like a series, right? And we all are forensic experts. We are on the crime scene and we have to tell time since death to the police. We have to submit our report to the court so that the justice can be given. Okay, got it? So these are the 12 parameters based on which I can tell the time since death. It's very easy. Everything is common sense. You have to just learn these 12 parameters based on which, looking at the dead body, we can tell time since death. Okay. Before coming on these 12 parameters, I would like to tell you the definition of postmortem interval. PMI. It is known as PMI. Postmortem interval. It is known as PMI, postmortem interval. What is the definition? What are the objectives? Why we want to know the time since death? If we found a dead body, okay, even suspected death in unnatural condition death, why we want to know this time since death? Why? What are the objectives? What are the general principles? And then I will tell you the 12 ways, how the 12 parameters based on which we can find out this time. It's very easy. Okay, so please understand it's a very important topic, I'm warning. So what is the definition? The time interval between death and examination of the body. I'm a forensic expert. There is a dead body handed to me by the police. Okay, I'm examining this dead body. So what is the time interval between the death till this moment? Death, what is the time between the death till the examination of the body? Okay, so this time interval is known as postmortem interval. This time interval between the two things is known as postmortem interval. The time between death and examination of the body. Learn the definition. Between death and the examination of the body. This is known as PMI. What is the full form of PMI? Postmortem interval. Okay. It is not determined based on single criteria. There are 12 criteria. Okay. Which are, some of them are based on physical changes in the dead body. Some of them are based on chemical changes, and some of them are based on the biological changes in the dead body. So in the dead body, we will see physical, chemical, and biological changes. There are 12 parameters, total 12 parameters, based on which I will come on a conclusion. What is PMI? Postmortem interval. That is time since death. Okay, so learn the definition. If you're done with the definition, what are the objectives? What are the objectives? Why you want to determine it? To identify the exact time of crime. Exact time of crime. Okay, if it is a murder, we want to know at what time the murder was done. Exact time of crime. It will verify suspect statement. If there are multiple suspects or one suspect, we will ask the suspect at that particular time, where were you? Because the time of death is that given by the forensic expert. Okay, so at that time, where was the suspect? So based on which we can see the suspect, we can match the suspect's statement. No? You watch movies, series, you are understanding all these. Huh? It adds investigation and inheritance in civil cases. Okay, and it determines the insurance policy. Sometimes insurance policy may last just at that moment only, insurance policy and all. So the time of death, if it is 1 o'clock, the insurance policy is valid, but if the time of death is 2 o'clock or 3 o'clock, it's not valid. It may be the cases in some time, no? Or it may be the cases of the inheritance, or it may be the insurance policy, whether it is valid or not valid at the time of the death. So time of death is important because of these 4 objectives. So learn the 4 objectives. It tells the time of death tells us the time of crime. In medical legal cases, time of death is equal to time of crime. If it is a murder, yes or no, time of death is equal to time of crime. It will verify the suspect statement. Where was the suspect at the time of the death? We can verify. Okay. It will add in the inheritance in civil cases and insurance policy validity. So these are the 4 objectives. So we are done with definition and objectives. Now I am a forensic expert. We are detectives. Yes. So we will follow 4 principles based on which we will tell the time of death to the police and to the court. We will submit our report based on the 4 principles. Forensic expert, based on these 4 principles, submit the report to the police and the court. What is the time of death? Okay, exact time of death cannot be told. No, I will not write down the death occur at 1 a.m., 1 p.m., 2 a.m. No. I will always give a range because exact, based on all 12 parameters, we cannot say exact time of death. No, it will be in a range. So always give time range, not a single value. So so save your skin first. Save your skin first. Okay, being a forensic expert, you have to save yourself first. Suppose I'm a forensic expert, first I will save myself. Then I will try to save others or give the punishment to the murderer, whatever. But first I will say, so I will always give the range. I will not give exact time because based on all 12 parameters, I cannot tell the exact time of death. I was not present at the crime scene. I don't know. Based on the 12 parameters, I will try to figure it out, but I cannot figure it out the exact value. Number 1. Number 2. Okay. Biological variability is there. It depending from individual to individual and environment to environment. The dead body is in which environment? Is it in moist environment? Is it in dry environment? It is submerged in the water. And individual to whether the individual is lean, obese, there are many factors to consider. We have seen, I have told you all of that. So biological variability is very high. That's why we should give the range. Okay. Accuracy decreases with time interval. So if death occur last few hours, suppose death occur, and just when the death occurred, the police got the information, and as soon as police got the information, I got a call from the police that you are a forensic expert, madam. Please do come at this site. We will take the permission from the court, and it's a medical legal case. Okay. So I'm reaching the crime scene very fast, within few hours of the death, and I'm examining the dead body within few. So accuracy will be high. But if the forensic expert is called very late, after many hours, so accuracy of this will be low. So these 4 principles will be there. So what are the 4 principles, people? What are the 4 principles based on which the time since death can be told? PMI can be told. Number 1, exact time of death cannot be told. Always give a range of PMI. Biological variability is always there, and accuracy decreases with the length of time. Learn these 4 principles. Give me a thumbs up, people. Come on. Now, can I start the 12 parameters? One line on each. Very easy. You know all of them. I taught you all of them. There is nothing new in this. Okay, we are just doing the revision, what we have read yesterday and today, combination of the both. Postmortem changes. I will include immediate, early, and late. All changes in this. Okay, that is the postmortem change, the chapter. Okay, so first I will see cooling of the body. First of all, I will see the cooling of the body. Let's start the 12 parameters. First, I will start looking at the cooling, the rate of cooling of the body. Yesterday, I taught you what is cooling of the body, algor mortis. I will, as soon as I will receive the dead body from the police, I will measure the rectal temperature of the dead body. And I will apply the formula. You know the formula. Normal temperature minus rectal temperature upon rate of fall. I will take multiple readings to know the rate of fall. Ideal rate of fall is 0.4 to 0.6 degree Celsius per hour. Yesterday I taught you. Okay. It is reliable only in indoor cases. It is not reliable in outdoor cases. So that is cooling of the body. Cooling of the body. Okay. Number 2, I will see lividity. First, I will see algor mortis. Then I will see lividity. Yesterday I taught you lividity. So lividity will tell me the position of the dead body at the time of the death. But currently I'm interested in time since death. So first it appears within 1 hour. Okay, it's fully developed in 12 hours and it is fixed by 18 hours. So I will see, is it just appearing or fully developed or is it fixed? So based on which I can give a range. Keep time since death is 1 hour or 12 hours or 18 hours. If lividity is 100% fixed, so time since death definitely more than 18 hours. If it is still developing, it is not fixed. So I will say it is 6 to 12 hours. And if it is just initiated, so I will say it is 1 hour. Okay, so it is useful for early PMI, less than 24 hours. You can see it is useful for early PMI. It is post-mortem interval. Early PMI mein it is useful. Okay, then I will look for rigor mortis. Then, being a forensic expert, first I have seen algor mortis, then I have seen lividity, then I will see rigor mortis. Okay, for algor mortis, I will apply the formula. You know the formula, rectal temperature. Here, it is useful for early PMI. You know early PMI. Okay, up to 18 hours. Okay, and this one, rigor mortis. So rigor mortis, you know what is rigor mortis? I'm not teaching you rigor mortis. It is a parameter to tell PMI, postmortem interval. Okay, the rigidity in the dead body, you can see. So it start at 2 hours. It start at 2 hours. It complete in 6 hours and it lasts for 36 hours. Again, it is a good guide for first 2 days. This one is for 1 day. Up to 24 hours, this can guide. Up to 24-hour death, this can guide. Up to two days, because 36 hours it can tell. Na? Suppose rigidity is still there. When I got the dead body, rigor mortis is still there. So time since death is within 36 hours. It is not more than 36 hours. If when I got the dead body, rigidity is already gone. It is secondary flaccidity. So time since death is more than 36 hours. Okay. So up to 2 days, it's a good guide. 2 days or 2.5 days. Okay, you are getting my point. Up to 2 days, it's a good criteria. The next is what I taught you today: putrefaction, adipocere formation, and mummification. I told you all 3 today, na? Putrefaction, adipocere formation, and mummification. So putrefaction, I told you 3 features. Color changes occurs in 12 hours. Gas formation occurs in 18 to 36 hours, and liquefaction occurs in 5 to 10 days. I told you today only. Adipocere formation 4 to 5 days, and mummification 6 months. This is all told you in summers. The winters, the timings will be less. Got it? So this is for longer PMI. This is for longer PMI. You can see it is in days and months. It is in days and months. So for early PMI, we look at this within 24-hour PMI. Within 2-day PMI, 48-hour PMI, we look at this. And within long PMI, if I get the dead body after 6 months, I will look for these changes. Then if I get the dead body after 3 months, 6 months, I will not look for all these. These are already gone. I will look for these. You are getting my point. The next is entomology. What do you mean by entomology? The insects. What is forensic entomology? What do you mean by forensic entomology? Study of insects on the dead body. Study of insects. There are many insects which get attracted on the dead body. So entomology. Looking at the entomology, we can predict the time. Okay. So if the dead body is fresh, the death occurs right now, we can get up to 150 eggs of the flies on the dead body. Okay, on the dead body, if fresh eggs are present, the dead body is fresh within few hours only. Within 24 hours, eggs will hatch and you will not get egg now. You will get maggots. You will get maggots. You will not get egg. Okay, up to 3 to 6 days, the larva will mature. The maggots will mature and they will convert into adult flies into 5 to 6 days. So you can see the life cycle of the fly. Okay, and based on which we can predict the time. Okay, and the next is gastric emptying. It will be useful if we know what is the last meal of the dead person, the deceased person, the dead person. What was the last meal? How much? Is it mild, moderate? How much the person have eaten? Okay, gastric emptying, because the point death is occurring, the gastric emptying stops. Okay, it is helpful if the last meal is known. Okay, if light meal is there, gastric emptying occurs in 2 hours. Medium meal, gastric emptying occurs in 4 hours. Heavy meal, it requires 8 hours. So suppose we got a dead body, we are doing the autopsy, we open the stomach, inside the stomach still food is there, and we will inquire the family what the person have eaten. Is it a light meal, moderate meal, or heavy meal? We will decide based on the food quantity and quality. Suppose the person have taken heavy meal and still food is present, so gastric emptying is not complete. So I will say from the time of eating of food and the death, it is within 8 hours. Like that we can come on some conclusion. Now one more fact is there: gastric emptying is fastest of carbohydrate, then followed by protein, then slowest for the fat. We can inquire the family or the known person that the diseased person, what exact meal the person have eaten. So does it contain carbohydrate, does it contain protein, what does it contain fat, what is the proportion of the three, based on the meal the person have taken, and based on which we can decide the time of the gastric emptying, and we can tell the approximate time since death. Got it? So this is the complete story. If so, overall interpretation, if you want to learn this, learn, otherwise learn the interpretation. If the dead body have a full stomach, so it is within 4 hours of the last meal. The death is within 4 hours of the last meal. If it is partial stomach, partial is fed, partial is in duodenum, the gastric emptying have occurred. Partial is in stomach, the partial is in duodenum. It is full stomach, the death is within 4 hours of the last meal. If partial stomach, partial duodenum, the death is within 6 hours. If the stomach is completely empty, so it is already past the duodenum and intestine. Okay, so death is more than 6 hours from the last meal. So last meal timing can be confirmed from the family when the person have eaten the last meal, the exact time, and from which we can consider the gastric emptying as a criteria. And if you know these facts, you can do the interpretation. How many of you got it? Give me a thumbs up. This is gastric emptying. Now CSF, we will aspirate the CSF from the lumbar puncture. We will aspirate the CSF of the dead body. We can do the lumbar puncture, and we can aspirate the CSF in a test tube. In the CSF, we will see potassium. Cerebrospinal fluid, we will see potassium. Potassium keep on rising in the CSF up to 20 hours of the death in a linear pattern. So it will tell us up to 20 hours. It will be useful in early PMI detection. So potassium increases in CSF linearly up to 20 hours. So it will tell us approximate time of death. Depending on the concentration of the potassium, we can tell the time. Suppose potassium is this, so approximate time of death is this, like that. There is a linear relation like that, but it is approximate. The next is blood chemistry. We can take the blood in a test tube from the dead body, from the dead person, deceased person. Okay, we can take the blood and we can see all these parameters if you want to learn. Lactic acid increases 50 times of the normal value. Acid phosphatase increases 20 times. Amylase increase 3 times, and LDH and AST linearly increases up to 60 hours of death. You can see the timing. So approximate timing can be tell, but it is not reliable. It is have limited reliability because blood coagulates after death. So it is not very reliable. Blood chemistry. The next, we can take the vitreous humor of the dead body. Yesterday also I taught you this now. We will take the vitreous humor from the dead person. We will aspirate it, and again we will see the potassium. Here also, like the CSF, we will see the potassium, and it is having a linear relation. There is a formula also if you want to learn. This is the formula. Whatever is the amount of potassium present in the vitreous humor, you just multiply here. 5.26 into the potassium minus 30.9. Whatever is the value. First you do this multiplication, minus 30.9. Whatever is the answer, that is the PMI. It is an approximate formula, not exact. That is the hours passed till death. It will be in hours. So if you want to learn this formula, okay, you can learn. And it is applicable up to 120 hours of death. This formula applicable. Okay, so vitreous humor mein potassium we can test. We can test the muscle enzymes. We can test the muscle enzymes, not important although. Okay, we will test myofibril protease and CPK. CPK you can learn, the important one. CPK decreases linearly and protease increases linearly. Okay, you don't learn, you have to learn the formula. Next is hair. You know, after death, hair don't grow. Normally, hair keep on growing at a very slow rate. Our hairs keep on growing, although we don't realize, but they are constantly growing at a slow rate. But hair does not grow after death. The moment death occur, hair does not grow. Okay, now we can see, if it is a male, we can see the beard, okay, the size of the beard, and we can ask the family when the last shave is done. So based on the size of the hair of the beard, we can predict the time of death. You got my point? We can ask the last shave done, when the last shave is done. And based on that, suppose last day is done 2 days back, 48 hours back, okay, from the time of examining the dead body, and the size of the beard hair, is showing it's 36 hours. After 36 hours, there is no growth. Okay, so 36 to 48 is the time of interval. I hope you are getting it. I'm able to explain you. So this is here. The last is radioactive carbon dating, which is not applicable in forensic medicine. Because in forensic medicine, we see the death up to 100 years. It tells the death before 1000 years. Okay, so the half-life is 5600. We read carbon dating na, in science in our school time. It is not applicable. Okay, because it is only useful for architectural remains. It is not for the forensic medicine, but these are the 12 parameters based on which we can predict PMI, postmortem interval. You just learn these 12 parameters, something to write inside, you will get it. What you have to write, you have understood it. And MCQs definitely you can solve. So we are done. Yes or no? This is the final table of time since death. Yes. So we are done with time since death. Okay. So today's session is done, people. Today is the fourth demo I have given. Okay. So PSM demo already done. Now the classes will be on app, PSM classes. FMT demo already done. Okay, now the classes will be on app. Okay, now we have ENT demo. Tomorrow there is no class. There is break. No class tomorrow, Wednesday, 15th October, no class. We will meet again on 16th. Okay, I will teach you ENT, the first class of ENT. Don't you dare to miss it, people, please. I will teach you assessment of hearing. Assessment of hearing. And I will teach you with a real tuning fork. I will show you the 3D models. Okay, it will be very super duper interesting class. So next class will be on Thursday. 16th October is not Wednesday, I'm sorry, it's Thursday. 16th October, Thursday, ENT, assessment of hearing. The class is on YouTube, not on app. The first session of all 4 subjects is on YouTube. The second session of ENT will be on app. Okay, the first session is on YouTube. The time is same, it's 6 p.m. sharp. For any queries, further queries of anything, you can WhatsApp on this number. You can note down this WhatsApp. Thank you so much. Wish to see you 6 p.m. a day after tomorrow on Thursday. ENT, YouTube. Okay, thank you so much. I hope you learned it. How was the forensic? You understood postmortem changes? The complete forensic is a small subject. We will quickly finish in the remaining 19 sessions. There are total 20 sessions of the forensic. So remaining 18, 19 sessions, I will pack this subject and it's an easy subject. I know it's more of factual, but I will help you in learning the facts in an easy way. Okay, got it, everyone? People, you are there? Huh? Respond now. Okay, chalo. See you tomorrow with the day after tomorrow with the ENT. Bye bye. Good night.